It says.
Oh, wait, yes. Sorry. How come I could do this so well the other time, but now? Yeah, right, so I want to share screen. Here. All right, you know what? I gotta work on this. Okay. But it's still like sounding funny, isn't it? Is this how it sounded before? Yeah, but I would have had to have brought them into the meeting. Ah, okay. All right, my friends, thank you for sticking around. I didn't mean to hurt your ears. I'm so sorry. Oh my goodness. Never a dull moment. See, it says mute here. I don't know if it should be on mute or not. Oh, it doesn't matter what I press. We're just gonna go with it. Okay. Woo. So exam averages grades were posted. Average was a 76. I can't give them back to you yet because there's a couple of makeups. Let's review what's going on with the schedule. Today, we should be able to finish pretty much everything. There are 2 shorter chapters, which means that Thursday is an open lecture. If I talk too much tonight, we may have to do a little bit of lecture on Thursday, but it won't be much. And then remember, Thursday, I'm going to bring copies of old exams that you can review. You can't take them home with you, but you can review. So it might be a good way to review some of the most important concepts. If I thought it was important enough to include on an exam, probably something to review.
Can you speak more to, because I asked about that big packet you gave us, and you
Yes.
said, I said, will it just be like, mixed up questions that were from the other test, and you said it'll be more broad concepts.
Yeah.
I'm having a hard time figuring out what that means exactly.
So let me give you my spiel about the file.
Okay.
Hopefully it'll clarify things a little. I did put an announcement on Blackboard with this information. 125 questions, cumulative. So we will have covered 14 chapters. So that breaks down to about 9 questions per chapter. Multiple choice, matching, true, false, same format you're used to. It will be in order, right? So you'll see chapter 1, 8 questions. Chapter 2, 8 questions or 9 questions, all the way to chapter 14. You should be reviewing the main concepts. It will be a little bit more general because it was during the unit exams when I could get a little bit more detailed. Let me give you some examples. For chapter 1, which of the following best defines homeostasis? What is an example of negative feedback? Let's think about a chapter that was more complex, like the muscle tissue. Or maybe even like the nervous, I can't say that one yet. The muscle tissue chapter. Instead of me asking you specific questions about every step of muscle contraction, a more broad way might be a question like, what happens in cross bridging? And you would choose the one that says, "Hey, I can sneeze." Excuse me. So a question might be like, what is happening in cross bridging? You would select the answer that says actin and myosin bind together. What is happening during the power stroke? The myofilaments slide past each other. So instead of being a little bit more detailed, a little bit more general, I mean, it's kind of hard for me to say, but that's why, look at the exams on Thursday. And if there's a specific question, like, for example, the nervous system. During depolarization, the inside of the neuron goes to what charge? That was the specific question. It goes to positive 30. But a more general question might be like, what is the first step of a nerve impulse? Depolarization, where the inside becomes positive. But that review sheet hopefully has been a way to help you see what you may remember and what you may not remember as much. Have any of you been able to start to go through it? It's not like you've been busy or anything. It is a lot.
Really?
So if you want to make it less overwhelming, on Thursday, you could mark on your review sheet the topics that I asked you exam questions on. You know what I mean? You could do that. To be honest with you, most of the time, students are pretty consistent. So, I find that the grades are pretty consistent with what students have done before. Once in a while, a student just doesn't prepare, and during the semester they did great, and then they just bomb it, but that's rare. But it's going to be fair. What we talked about, a little bit more general. But a good thing might be on Thursday to put a little star, the things on the review sheet that I asked questions about on the exams. I mean, how many questions were there on each lecture exam per chapter? 20? Maybe 15? Hopefully, my hope is that some of the things sound familiar. I'm going to hold on hope forever. So our final exam is next Tuesday, 1 week from today. I left open next Thursday in case there's a snowstorm or something. So if we have the exam on Tuesday, then you don't need to come on Thursday. In lab, we're meeting this week. Nervous system practical. We'll do the cow eye dissection. And then I'm giving you a take-home quiz that you can bring to the final exam. You can email it to me. But we're not meeting in lab next week. Any questions? Yes. Oh, no, did we? We didn't? Oh, crap. Yeah, we didn't. You're right. Slide 31, 61. All right. So we'll probably, thank you. I get my sections confused. You're so funny. You're not being that person. So we'll finish what we can today. We might need to do a little bit on Thursday, but not much. All right, here we go. So there really isn't that much to say about the spinal cord, but I do want to make sure we talk about it. Especially since we did this in a lab, right? Is this the case for anybody with your pet? They sleep in your bed and does your spine get realigned? My doggie, Allie, she had a wonderful dog bed on the floor. My bed, yes. She was not on any furniture. Get up. It's a personal choice. All right. Here we go. So let's talk about the spinal cord. Just ignore this. See, technical problems everywhere. At least my previous attempts, it's work, right? It actually records.
That's great.
So this is the end of the central nervous system. And we talked about the brain. What's the other component of the central nervous system? The spinal cord. We know what it does. The primary function of the spinal cord is to transmit nerve impulses. It transmits nerve impulses. It's a nerve impulse superhighway. And as we talked about in lab, the spinal cord is able to do some processing of reflexes, right? Those are the functions we're going to stick with. You should know by now fairly well, we have a test on it this week, the anatomy of the spinal cord. So I mentioned this in lab, let me say it again. The spinal cord itself ends around, I would say around L2. What is the name of the branching network of fibers coming off the bottom of the spinal cord? Cauda equina. We know that there are certain areas of the spinal cord that are larger, thicker. Tell me again, why is the cervical spinal cord a little bit thicker? Yeah, because we got more nerves coming off because of the arm. Why is the lumbar area thicker? We got more nerves coming off of the legs. We know the cauda equina. We didn't worry about these because I was feeling nice. Don't expect that next semester. Come back into January. Dive right in, folks. If the spinal cord ends around L2, if you need to shove a needle to get cerebrospinal fluid, like a spinal tap, or shove a needle in there to inject for an epidural, to inject medication, don't you want to do it below L2? So if we were to inject a needle higher, you might be at risk for nicking the spinal cord. That would not be good. There's ways, I think I mentioned this in some of the labs, I can't remember who I mentioned it to, who I didn't. You know the iliac crest? The top of the iliac crest, if you follow it, I think it's about L3. I have to check my notes. You'll feel the spinous process of L3. So there's bony landmarks where people will be able to count, to be able to identify a place below where the spinal cord ends. Good. We know the anatomy, right? The gray matter has the ventral, dorsal, and lateral horns. Let's talk about function. The gray matter is able to do processing. What part of the nerve is in the gray matter usually? The cell body or the axon? Cell body. So usually the cell body is what's in the gray matter. The cell body has the nuclei, which is why the gray matter is able to do some processing. So it is in the gray matter of the spinal cord where that processing of reflexes occurs. The gray matter is not going to be an area where we transmit nerve impulses.
Don't these cell bodies talk to each other?
Yeah,
Are there like nobody with axons talk to each other?
there's other ways of communicating. So it might be sending a graded potential, a little mini impulse to each other. It could be, yeah, that's probably the best answer. Because you're right, that gray matter is like half full of nuclei, it's not just one. Many, many.
The dendrites are considered gray matter too, correct?
Usually, yes. Usually the dendrites that are coming off the cell body are considered gray matter. It isn't always the case that the cell body is gray matter, but almost always. So the gray matter is where we're going to do some processing of reflexes. Someday I'll get it. We already talked about the dorsal and the ventral side. I want to remind you, back here, the spinal nerves are mixed. What does mixed mean? There's afferent and efferent. So there's some nerve impulses that are going towards the spinal cord, afferent. And there are some nerve impulses going away from the spinal cord, they're efferent, right? So all of our spinal nerves are mixed. It's a bundle of mixed axons. Each individual axon is one or the other, sensory or motor, but it's a bundle of mixed, some sensory, some motor. But once we get close to the spinal cord, they split, right? Make sure you remind yourself. Sensory information comes in through the dorsal root and into the dorsal horn of the spinal cord. So even though it's mixed here, right before the spinal cord, the sensory goes towards the back. Sensory information is always coming in through the back. And then motor impulses come out the front. Sensory information in through the back, or dorsal horn, ventral out through the front. Good. Here's a picture of the spinal cord. It's kind of cool. I was saying it reminds me of polio string cheese in its diameter and stringiness. Look at that beautiful pia matter. One of my other students was telling me he's watching a Korean TV drama about doctors, and one of the surgeons in this TV show, one of the surgeons would hard boil an egg, and then after it's hard boiled, take the shell off. But you know how there's a little coating still over it? This surgeon was practicing with tweezers or whatever surgical tool to remove that thin layer as if it were pia matter. Because apparently the pia matter is just as delicate, or maybe it feels similarly to that little film over the hard-boiled egg. Isn't that kind of cool? So the spinal nerves are the ones that are mixed, right? They come off the spinal cord, fine, whatever. We know the white matter. The white matter, the regions are called funiculi. If the white matter, what is the white matter? What part of the nerve is the white matter made up of usually? Axons, right? So this white matter is just a bunch of axons. So if the white matter is axons, what do you think its function is? Transmit nerve impulses. The gray matter is where we can do some processing of reflexes. but it is the white matter. Then the axons were constantly sending nerve impulses up and down. I have this picture here because I want to demonstrate what that might look like. You don't have to know these tracks. But look at this picture on the right. This is a good way of visualizing one axon. This is a sensory axon running through the white matter of the entire spinal cord. And we can actually map it out. So we can map out each different region, right? You don't have to know these, but this is an example of the spinal thalamic tract, spinal thalamic pathway. It is right here. So this region, we know, is made up of axons that are, if it's ascending, what kind of nerve impulses are being sent? Sensory. So we just know that this area right here is sensory neurons, sensory axons, and if you follow that up, it's sensory from the bottom of your foot. Isn't it cool that you can map it out? So the sensory neurons from the bottom of your foot, look, they come in through the back, travel through the gray matter briefly to this part of the white matter, travels all the way up through the thalamus. And it can actually tell you where it's going to go in the brain. Isn't that cool? This part is going to the primary somatosensory cortex. One of my grad school classes had to memorize these boogers. I memorized it, and then I quickly forgot it. Good, that's it, simple, don't even worry about anything else. Okay. 2 shorter chapters. I do have a random question. How many of you would be able to come to a I mean, I know that it's not going to be that way, but I'm just wondering, based on your work schedules, how many of you would be able to come to a 4 to 6 lab and then have lecture right after? Do most of you come from work later, couldn't make it to an earlier lab? Some of you could. Anybody else? Because looking ahead, because I teach at 8 a.m. and going till 9:30. I don't want to teach tonight anymore, but the students are so great. So we're just floating ideas. So I was wondering if we could do the lecture still 6 to 7:20, but maybe have one, like Tuesday's lab 4 to 6, and then Thursday's lab 7:30 to 9:30. So you would pick a lab, either you'd come 4 to 6 or you come 7:30 to 9:30. But I just thought I'd poll the class and see, because I know a lot of you work. So most of you couldn't come earlier. A couple could. I mean, it's not going to change for the spring. It's not going to change. But I'm looking like future years down the road. I just figure if being here till 9:30 is so late, being here till like 7:30, it's a big difference. But I know one of the benefits of the evening class is a lot of you work, so that's the idea. I mean, you gotta come one night anyway, so what do you care? Okay. Cool. Okay. You answered my question. I'm stuck with the late nights. Okay, so we have 2 shorter chapters to finish things out. Here we have a chapter on the peripheral nervous system. So we have now completed our discussion on the central nervous system, brain and spinal cord. Now we're moving on down to the peripheral nervous system. Don't be too excited now. What makes up the peripheral nervous system? Our spinal nerves, you know, femoral, sciatic, radial, ulnar, brachial, musculocutaneous, you name it. Those are our spinal nerves, the nerves that leave our spinal cord and go through our body. But also our cranial nerves are considered part of the peripheral nervous system. Remember the olfactory and optic nerves from the brain? This can be a little tricky because they're close to the brain. Many of these cranial nerves attach to the brain, but they're not in the brain. So therefore, the cranial nerves are considered part of the peripheral nervous system. They're outside of the brain, they're not in it. What is the function of these peripheral nerves? Tell me. You know what they do? Gotta wake you up. You'd be happy you're in this class. This morning in my 8 a.m. lab, we were doing body composition measures. We got the calipers out. Each other's fat. Oh, yes, baby. Course nutrition lab. Made everyone do the skin fold. Okay, we're not going to get carried away here. All we're going to say is the same thing we said in lab, which is some of the nerves leave individually. Some of the nerves form a little cluster, and those clusters are called plexi, plural. So some of the spinal nerves leave the spinal cord individually. Other times they form a little network called a plexus, of which you know, right? Cervical plexus, brachial plexus, lumbosacral plexus. Don't worry about anything else on this screen, if that's okay with you. Okay. This is a typo, it should be 31. I apologize for that. Nothing here we're going to talk about. Cool, let's talk about this. So each spinal nerve, it's not just one axon. Each spinal nerve contains many, many, many axons. Doesn't this kind of look like a skeletal muscle? Do you see that word fascicle up there? It looks like what? Oh, I thought you said mold. So just like the muscle, these axons are arranged in clusters. So if we were to say, for example, the femoral nerve, it's not just one axon. The femoral nerve is a big bundle, and inside are these smaller bundles. I would like you to know the connective tissue covering over the whole darn thing, the epineurium. The connective tissue covering over the whole spinal nerve is called the epineurium. Don't worry about the rest. Now remember, these are mixed. So if we were to look at each individual axon has to be one or the other. So let's just say these red ones that I'm coloring in are sensory or afferent. So each individual axon can only send nerve impulses one way. So for example, these red ones I put in, they may be afferent or sensory. But right beside it are blue ones that are motor. Do you see what I mean? The level of excitement. Hey, listen, 1 week from today, you're gonna walk out of here happy Proud of yourself. Maybe you'll walk right over to the Tipsy Moose. We already know that out here they're mixed. But then once they get closer to the spinal cord, I'm reviewing again. Sensory comes in through the back, motor out through the front. Okay. Now, of those 31 spinal nerves, what do you notice about these numbers?
There's an extra cervical.
There's an extra cervical. Someone done learned real good. There's an extra cervical. So I'm not going to ask you this on the final. I'm not, but I just wanted to point this out. So if later on, for some reason, you see this, I don't want you to say, oh no, there's not an acervical spot, because there is. Does anybody know why that is?
On the superior side. The first. Start out on the superior side and then there's
Correct. So for the cervical spinal nerves, let's just say we have, I'm just going to call this C6 and C7. In the spinal nerves, they exit above the same named vertebra. So the C6 spinal nerve exits above the C6 vertebra. The C7 spinal nerve exits above C7. But then we have the thoracic, right? We have C8. So all the other C's leave above the same named vertebra, except C8 leaves below C7. And then from there on down, thoracic leaves under the same named one. So T1 leaves under T1. I'm not going to ask you this. I just want you to know that that's not a typo. There is a cervical spinal nerve. Okay. If you have any questions, you're going to let me know, right? Yes. We already talked about some of the plexi. I figured why not put a cadaver picture in there? The brachial plexus is the one that's right by the shoulder. Little cluster of nerves. It is really superficial. Isn't that crazy? Do you remember in the muscle dissection when we were doing the arm? I believe in every class I found one of the nerves and I pulled on it. And I asked you, what could this be? Like a guitar string. That was one of the nerves of the brachial plexus. So they're strong, they're tough. Look at how many there are right here. So if someone dislocates their shoulder, this is why it's dangerous to possibly relocate it right away, because you might accidentally pinch one of these. You ever heard of a stinger or a burner in football? A stinger or a burner in football is if someone gets hit or they fall and their neck goes one way and their arm goes the other. What it's doing is it's pulling these brachial plexus nerves, and they may have radiating numbness tingling down their arm. They can feel really crappy. They just kind of inflame and stretch these nerves. We talked about the lumbosacral plexus. Oh, look, it's a cadaver butt. Look at how big this sciatic nerve is. So they peeled back the gluteus maximus. That's like a highlighter diameter. Is that crazy? There's a muscle called the piriformis that a lot of times the sciatic nerve goes in between the muscle. So a lot of times a really tight piriformis can lead to sciatica. make sure you can define dermatomes and myotomes. And use the word derma. Derma means what? Skin, skin. So a dermatome is an area of skin innervated by a nerve. An area of skin innervated or supplied by a nerve. There's a whole map. I'm not going to ask you these, but this is a map of the sensory places that these nerves come from. So if someone were to have a loss of sensation, if someone were to have a loss of sensation right here, it could be an issue with the sensory nerves that are in the C5 nerve root. You see what I mean? So we can map out where those sensory nerves come from. You don't need to know the map, just the definition. Area of skin innervated by a nerve, which means that a myotome is a muscle innervated by a nerve. You don't have to know any examples. But if you want to get real detailed about muscles, you can give the origin, the insertion, and the action. And you can also give the nerve that supplies it. For example, the trapezius. Wait a minute. Oh, yeah. We know about the neuromuscular junction. So the nerve branches that go into your trapezius have come from the nerve root of C4. Many, many years ago, when I was an athletic trainer working in the field, I had a cross-country runner who all of a sudden couldn't move his deltoid. I'm like, you're a runner, dude. With your arm. Come to find out, he had a problem with his C5 motor nerve. So his muscle was fine, but there was some kind of pinching of the C5 nerve at his spinal cord. Where it comes out. Oh. Don't be too excited now. The cranial nerves, there are 12 pair of them. You only have to know 3. Now this is really nice of me. Come on. Should memorize all 12. So we already talked about the olfactory. That's cranial nerve number 1. Where does that go? Olfactory. Nose. And we already discussed the optic nerve. Where does that cranial nerve go? Okay. The eyes, right? These are nerves in and around the brain. We already talked about the olfactory nerves. Remember those? Remember the olfactory bulbs at the end? These are the optic nerves. And then where they come together is the optic chiasm. Well, we have a whole bunch of them. I'm also going to ask you to know the vagus nerve, number 10. We'll discuss in a moment. Yes, 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 yes. If you ever have to memorize these, have any of you ever had to memorize? Yeah. No. I learned it. How long was 1997? 24 years ago. Okay. So I learned it 24 years ago, and if I don't say it every year, I'm not going to remember. So because I memorized them. So if I don't say it every year, I'm going to forget. And then I'm going to be perceived as less smart, and I can't have that. Olfactory, optic, oculomotor, trochlear, trigeminal, abducens, facial, vestibulocochlear, glossopharyngeal, vagus, spinal accessory, hypoglossal. I had the stupidest, like the more common saying is something like on old Olympus, top, blah, blah, blah. Our old trusty truck, something. Those are way more fun.
It's like the world's better.
Everything was.
Well, show me those. Look at what we did.
Okay, well, the town has a lot of words.
So this is not
not.
bad. I'm gonna get fired, huh? It is recording, right?
No, they can't see anything.
I know, but this is recording.
Oh.
And then what you'll see is some of the cranial nerves are only sensory. Like, for example, the trigeminal nerve, you don't have to know it, but the trigeminal nerve only has motor axons. The way that I used to remember this is trigeminal, I would think about trident if you're chewing gum. So you don't have to know it, but the trigeminal nerve is a motor nerve to the muscles of your mouth. Others are only sensory. Oh no, that was both, motor and sensory. What am I talking about? This is only motor.
There's also a mnemonic device, that one.
What is it? Is it dirty?
No, but not that much. Some say very muddy.
Oh yeah, that's for motor and sensory. But my brother says brains matter more.
Yeah.
Boobs matter more. Boobs or brains. Yeah, that's to remember if it's motor or sensory or both. Right?
Yeah.
Yeah. You don't have to know that. You just have to know olfactory, optic, and vagus. Olfactory goes to the nose, optic goes to the eyes. Let's discuss the vagus nerve. Number 10, cranial nerve. The vagus nerve is the only cranial nerve that goes down into your thorax and abdomen. All the other cranial nerves stay around your head and neck. All the other cranial nerves, when they branch out, all the other cranial nerves stay in your head and neck. The only one that travels farther is called the vagus nerve. It originates in the brainstem, but look where its branches go. The vagus nerve branches go everywhere. Trachea, esophagus, heart, lungs, gut, everything. You only have to know what I'm telling you. This is a lot of extra information. What I would like you to know about the vagus nerve, when an impulse travels down the vagus nerve, or one of its branches, its effects are parasympathetic. When we send a nerve impulse down the vagus nerve or one of its branches, the effect is parasympathetic. What does parasympathetic tell us? It's the resting and digesting, right? And we're going to discuss this more in our last chapter. But a parasympathetic response is to lower heart rate and blood pressure and respiratory rate. But it increases GI and kidney activity. So when we send an impulse down the vagus nerve, its effects are parasympathetic. If a vagus nerve impulse goes to the heart, what's going to happen to heart rate? It goes down. So if we send a nerve impulse down the vagus nerve to the heart, because the vagus nerve is parasympathetic, it will decrease heart rate. If we send a nerve impulse down a vagus nerve branch to your stomach, the effect will be to increase stomach activity.
So if it merges all the bundle, how does it split up? So like a plexus?
So this is just like a tree branch,
Okay.
right? Let me go back. The only sensory function for vagus is taste, but really that's not very much at all of its function. So when I talk about the parasympathetic effects, this is a motor function. So we're really just looking at a tree branch of nerves that are bundles of motor axons.
So doesn't it all have that one? Fire is-
Of course, of course. Of course. What we're going to find is the sympathetic and parasympathetic is coordinated by the hypothalamus. So it is the hypothalamus of the brain that is initiating certain impulses down these branches at certain times. This will probably make more sense when we get to the autonomic nervous system. This is all extra. All extra. I want to talk about reflexes. We already introduced this, didn't we? Rapid response to a stimulus. What is the function? What is the reason we have these reflexes? Protection. We know the steps of the reflex arc. Now, let's get more specific. So in this chapter, in the peripheral nervous system, we're going to be focusing on somatic reflexes. And for the record, these are the reflexes that you're thinking of. Like the knee-jerk reflex is a somatic reflex. When you see the word somatic, it's indicating to us that the effector, remember the last step of the reflex arc is that an effector muscle is stimulated. If a reflex is said to be somatic, the effector muscle is skeletal muscle. Somatic is friends with skeletal muscle. Next chapter, we'll talk about the other reflexes that are called autonomic. And of course, by process of elimination, the autonomic reflexes are autonomic because they supply smooth and cardiac muscle. But for this chapter, we're sticking to the somatic. Good. One example of a somatic reflex is the stretch reflex. That was a patellar tendon reflex, right? So just know that a stretch reflex was an example of the knee kick, the patellar tendon. And the goal was to protect from overstretching. Even though in that position, you really weren't at danger of overstretching, because that tendon was slightly stretched, it just so happened to trigger this response. Oh, here we go. Okay, so we're going to be talking about some of the specific receptors. Go back to the reflex arc. The receptor is the first step, right? Well, there are different types of receptors. We know that. We got all different types of nerve endings. Some nerve endings sense for temperature. Other nerve endings sense for touch and pressure. Blah, 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 blah. In terms of our somatic reflexes, we're going to talk about two specific receptors. One of them is called the muscle spindle, and one of them is called the Golgi tendon organ. Have you heard of these before? Okay. The excitement is overwhelming. Overwhelming. All right. So let's do, I'm gonna make a little summary chart. So here are receptor types. One of them is called a muscle spindle. One of them is called a Golgi tendon organ. Not to be confused with the Mustang. GTO. Come on. You know my first car, what was your first car? My first car was a 1976 Chevy Nova. V8 bench seat, it was called the Silver Bullet. It's kind of a hoopty, you know? I wasn't cool enough to pull it off, but I tried. So the first thing we're going to talk about is where are these receptors located? Okay, so these are types of receptors. One of them is called a muscle spindle. The muscle spindles are located in the muscle belly. In other words, there's these sensory nerves called muscle spindles. They're located, these specialized receptors are located in the muscle belly. When a muscle spindle, hold on. Each receptor senses something different, right? A muscle spindle is all about sensing changes in length, or in other words, stretch. So a muscle spindle is a specialized receptor in the muscle belly. It senses changes in muscle length or the amount of stretch. Isn't the amount of stretch the same thing as length? So the muscle spindle is an example of the receptor active in that stretch reflex. So we have these specialized receptors in the muscle belly. They sense changes in length. What they're afraid of is too much stretch, right? So when they're activated, this is a reflex, right? So these muscle spindles constantly sense for stretch. If it senses too much stretch, what is it going to do? Cause the muscle to contract. So when that sensor, when that receptor, when it's activated, it causes contraction. Muscle contracts. That's the whole idea. Remember this, it's a stretch reflex. If this receptor senses too much stretch, how am I going to protect against too much stretch? Contract. When I contract a muscle, what happens to the length of that muscle? Doesn't it get shorter? When I contract a muscle, it gets shorter. So in an effort to protect from too much stretch, it causes the muscle to contract. A specialized receptor inside the muscle belly, constantly sensing for changes in length. If it senses too much length, oh no, could tear the muscle. If it senses too much length, it will contract reflexively to protect the muscle from too much stretch. I use the example in lab of when you fall asleep, remember? So there's muscle spindles in your trapezius. They're sensing too much stretch. At a certain point, they get activated. What do they do to prevent you from stretching even more? They contract the muscle.
I didn't do much tonight.
I gotta dance. You're focused, laser focused. On the other hand, actually, before I do that, related to a stretch reflex is a reflex. Now, don't overthink these two. This slide and this slide, we're going to keep it really simple. Don't overthink it. We just talked about the muscle spindle and the stretch reflex. Okay. Put that aside. We're going to be really simple. Are you ready? There's something called a flexor withdrawal reflex. If you touch something hot, what is your reflexive response? Pull away from it. Usually to pull away from dangerous stimuli, you have to flex some muscles. That's why it's called a flexor withdrawal. You step on your kid's Lego in the middle of the night on the floor. Flexor withdrawal. Or you stub your toe on the coffee table corner. The flexor withdrawal. Sometimes it's like you don't feel most of the pain until you've already pulled away. You know what I mean? That's because the initial response to pull away was a reflex. It wasn't like you keep touching the hot pan and it goes to your brain. Oh, let me process. I think that's pretty hot. Maybe I should pull my hand away. That would take too long. So there's a reflexive response, and then more nerve impulses go to your brain, and you're like, oh, crap, that hurt. If we're talking about the flexor withdrawal, it often has, at the same time, a crossed extensor reflex, where you flexor withdrawal with one side, you tend to extend the other. It's a reflex. Think about stepping on your kid's Lego. You pull away with this side, but you better extend with this side. What if I flexor withdrawal both? You fall down. So these usually work together, and it's wired that way, that one side flexes away from the stimulus, but the other side extends to help hold you up. This is as simple as can be. Pull away on one side, flexor withdrawal. Other side extends to hold you up. That's not so bad, right? Making you work hard today. Now I'm going to talk about that Golgi tendon organ, and we'll just do a compare and contrast when we're done with this chapter. Whereas the muscle spindle was a specialized receptor in the muscle belly, a GTO is a specialized receptor in the muscle tendon.
Sorry, can you use a darker color?
Excellent for you. Of course. Thank you for asking. Is that better?
Yeah.
Okay. Sometimes it looks prettier on my screen and not so much
Yeah.
up there. That's better. Of course. So whereas the muscle spindle was a specialized receptor in the muscle belly, we have these other specialized receptors in the tendon. That's why it's called Golgi tendon organ. The Golgi tendon organ is a receptor in the Golgi tendon. The Golgi tendon organ senses for changes in pressure. or you might hear it called tension. The Golgi tendon organ is constantly sensing for changes in pressure. The example I give for this one is if you're doing weightlifting, doing the bench press. Got it. What if I try and lift more weight than my muscle can handle? Or I try and go too long? My Golgi tendon organs, as I'm trying to lift this weight, my Golgi tendon organs are sensing that pressure or tension. They're sensing the load on that muscle. And their job is to protect against too much load, too much pressure. So if these Golgi tendon organs sense too much pressure, what's their reflexive response going to be? To relax the muscle. Inevitably, if it's more weight than you can handle, you're probably just going to drop it right in a spot. Or if I'm doing a deadlift or something, right? Trying to do the clean. Whew. Whew. Well, if it's more than your muscle can handle, there's a reflexive response to just let it go. That's a reflex. That Golgi tendon organ is sensing too much pressure. In an attempt to protect your muscle from tearing off the bone, it reflexively relaxes the muscle. Okay. The rest here is all extra. I'm going to start this stretch. I'm determined. We'll finish it on Thursday. I got good news for all of you. This is our last chapter. Good news. Yes. We've been on a journey together, haven't we? Yeah, she's with the side. Yes. I know. I understand. I understand. So what I want to do with what little time we have left is I want to set the scene for this last chapter. It only has, what, 33 slides, so it's not that long. This chapter, the autonomic nervous system, can be tricky because it's a little bit more conceptual. So some people have a hard time kind of wrapping their heads around it or visualizing. This is our last chapter of the nervous system. Let's just think about where we are. We talked about the nervous tissue, the parts of the nerve cell, nerve impulse. Then we talked about the central nervous system. Then we talked about the peripheral nervous system. And this is our last little part. What on earth is it? I love this table graph, so simple. So look, we are only focusing on the peripheral nervous system and even further narrowed. We're only talking about motor peripheral nerves. So I just want to set the scene. We are about to talk about peripheral motor nerves. That's it. This does not talk about sensory nerves. We're not talking about the spinal cord or brain, really. We're only focusing on our motor nerves, our peripheral nerves that are sending messages in this direction. And even more specifically, I already introduced somatic. What did somatic mean? The somatic reflexes goes to skeletal muscle, which means that the autonomic nervous system We are talking about the peripheral motor nerves that go to smooth and cardiac muscle. We're only isolating those nerves. The peripheral motor nerves that are going to smooth and cardiac muscle. So just imagine, we're only looking at some of the motor nerves. The motor nerves out here, we're not talking about. They go to scale. We're talking about these motor nerves. So look at this picture, right? It's showing us motor nerves and motor nerves that are going to smooth and cardiac muscle. Tell me about the muscle that makes up the heart, cardiac muscle. Tell me about the muscle that makes up the stomach, smooth muscle. So we're really talking about the motor nerves that supply our thoracic and abdominal cavities. That's it. What do they do? Let me rephrase that. I can't decide what I want to say. How about that? I like that. What do these motor nerves do? Because they send motor impulses to our heart and organs, they can help to regulate them. These motor nerves have a major role in regulating the major organs of our thorax and abdomen. Look at that. Simplify. How do they do it? Oh man. Damn it, we don't go back to those reflexes. So I want to discuss the function, then we'll be done, okay? In the last chapter, we talked about somatic reflexes. Reflexes where the effector muscle is skeletal, like the knee jerk, like the flexor withdrawal. Now, technically, we're talking about visceral or autonomic reflexes. Autonomic tells us that it's a reflex where the effector muscle is smooth or cardiac muscle. So technically, these autonomic nerves, these motor nerves that go to smooth and cardiac muscle, help to regulate our main organs through a reflex arc. But you don't have to make it all complicated. Didn't we talk about the reflex arc really when we began this whole nervous system? Do you remember? Back in the nervous tissue chapter, the very beginning. What are the functions of the nervous system? There was that stupid picture of the dude looking at the glass of water. Remember that? And the dude was like, I want that water. It's really it's a loop, right? There's got to be sensory information coming into his eyes, processing, and then sending out a motor response. The autonomic nerves work no differently. There's got to be sensory feedback. Let me give you an example, then we'll be out of here. An example would be, for example, like stretch receptors in our stomach wall. Let's say we're talking about stretch receptors in our stomach wall. What if those stretch receptors sense very little stretch? That means the stomach is empty. What type of feedback, what type of sensory feedback are those sensory neurons going to send to the spinal cord and brain? It's going to say the stomach is empty, feed me. So the gut, your heart and lungs, all these organs are constantly sending sensory feedback to the brain. The brain processes it. And then the brain sends out an appropriate motor response through these autonomic nerves. In other words, through the motor nerve that supplies through the cardiac muscle. So it's a simple reflex loop. We're constantly sending sensory information to the brain. Brain processes and sends out responses through these motor nerves. In the case of the stomach, those stretch receptors sense very little stretch. Sends a message to the brain, we're hungry. It may send a message to the hypothalamus, which is our hunger center, so it'll actually make you feel hungry. And you eat. Part of the motor response is going to be to send motor nerve impulses to the smooth muscle of my stomach to churn after I brought in the food. Or let's say I start exercising and my blood oxygen goes down because I'm exercising. So my muscles have sucked up all the oxygen. So the receptors in my liver, the receptors in my lungs, the receptors in my kidneys, all sense low blood oxygen. Sensory impulses go to the brain processes. What kind of responses are going to happen? What are the autonomic motor nerves going to tell the heart to do? Pump faster. So we send a motor nerve to the cardiac muscle, pump faster, pump harder. It's going to send autonomic nerve impulses to the smooth muscle of the airways to tell them to dilate. So we're only looking, in this chapter, we're really looking at this part of it. We're looking at the motor nerves that go to skeletal and cardiac, smooth and cardiac muscle. And they're helping to maintain our function. Thursday, we'll finish this, and then I'll bring exams. And I won't forget where we ended. We're already at slide 8, see?